Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Camille back here with us today for his last treatment here in Houston before he leaves to go back 7,500 miles back to Poland, but he's going to Chicago first, have the weekend up there, and then take off back to Poland. But I'm going to spend some extra time working on Camille today, showing you the significance of what's called the somatovisceral reflex, which is where the muscles reflex directly to the same nerves as the organs that are supplied by that same nerve that supplies the muscles in his paraspinal area. So we're going to go over that with you in detail today. Let's take a look in the mirror here. Okay, we still evaluate the posture every time. Let's have you flex your head forward and backwards for me, Camille. And then I'll let him tell you how it felt afterwards. We've been treating Camille for a hiatal hernia that he's been plagued with for how long now?
2 years.
2 years. And we've been getting some pretty good results on that. However, he's had some continuing numbness and tingling in his upper extremities, especially in his forearms and in his fingers, so we're going to be working with that today as well. Very good. Okay, got that. So I am not going to pull you this first thing, Camille. I'm going to have you come over here on this table, and I'll need you to take your shirt off and your t-shirt for me, please. Now I'm going to be using some extra strength blue emu oil as I do this work on him. And I'm going to adjust him first. And so, first thing we do is check his leg length. And his legs are even, so that's a good start. And they stay even, so that's good. And you can tell with the shoes on, right, where the heel meets the sole, if his legs are even. I don't look at the bottom of the soles, because oftentimes those are worn off on one side more than the other. So those of you who are always wondering and asking questions, well, how can you tell which leg's shorter than the other one with his shoes on? That's how. You also look at the medial malleolus of his ankle as well. There are anatomical landmarks that you use, not just looking at the sole of his heel. So I'm adjusting him first. It's always better to get adjusted first and then muscle work. A lot of people think it's better to get a massage first because you'll be more relaxed. That's not really true, because when you work on muscles with massage or myofascial release, or what I'm getting ready to do today, which is called NEMO, really. There, excellent movement. That's good too. Okay, may have one more little one right here. There we go. So the adjustment still is the most significant and important part of restoring neurological integrity to his organs, muscles, tissues, and cells of his body. That's what chiropractic's really all about, is restoring function to the organs, muscles, tissues, and cells by removing nerve interference at the spine, where the nerves exit the spinal cord and go out and supply every organ, muscle, tissue, and cell in the body, including his skin, which is the largest organ in his body, in all of our bodies. So I'm going to rub some blue emu oil on his back here. By the way, this is a topical analgesic as well, so you'll get some muscle relief from this too, Camille. Now you're going to notice I'm going to use my thumbs first just so I can feel, and right on the paraspinal muscles next to his spinous processes. See, I went over one right there. Do you feel that one?
Uh-huh.
And then where he's really going to have substantial tightness is right here in his lower thoracics, like right there, all the way through here, especially on the right. You feel that one?
Yeah.
And you can probably see my fingers kind of bouncing a little bit. This is where the muscle bundles are in the paraspinal muscles. Now these muscles correspond neurologically to organs in his abdomen and then up here in his upper cavity, chest cavity. Okay. Put in my hand a little bit, warm it up a little bit first. Okay, so now I'm going to be actually using my elbow, and start off slow. You don't dig in hard, but you move very slowly up the paraspinal soft tissues, and you can tell when I get to those knots, you'll see them kind of bounce right there. And you kind of hover over those for a second until you slip off of them like that. Wow. Right there. Keep breathing. There we go. Now I'm going to move on up a little bit more. Now this area right through here supplies the stomach and the celiac plexus, which is gallbladder, pancreas, esophagus. And then up in here, this upper thoracic region and the traps and levator scapula muscles, the thyroid and the lungs and the heart, all supplied by the nerves out of T1, T2, really T1 through T4, and then work down. But mostly, you want to work up. Now this side's probably going to be worse, especially like right there. Do you feel that, Camille?
Yeah, it's coming off, yeah.
Yeah, that's it. Keep breathing, that's it. Good job. He will probably benefit from this treatment more than any other treatment that I've done on him to date. I used to do this at Palmer College of Chiropractic with a friend of mine. We were taking a postgraduate education course in NEMO, and we worked on each other and practiced this technique for 3 months, and I felt the best I've ever felt in my entire life getting this done. But we worked on everything from the head to the toes, including the muscles on the scalp. It would take about 2 hours to actually complete the entire spine and extremities, every muscle group in the entire body. There, boy, right there. Feel that one?
I do.
Yeah, I know you do. There we go. And these are all really sore right through there. But applying this pressure steadily and slowly like I'm doing not only helps the muscle bundles relax more, but it stimulates the somato, meaning muscle, visceral, meaning organ, and reflex, neurologically. And that's the importance of this. Oh, right there it starts. And it gets worse right through here. Boy, you can see that knot right there. I see you see me slipping on that one there a little bit. It's a pretty big muscle bundle right there. There we go, right there. Keep breathing, that's it. As you can see, I'm applying quite a bit of pressure here on this, and this is one of those hurt so good treatments. Feel a lot better when he quits hurting. One of my favorite lines. And then work our way down. And you notice now most of the time I use from the bottom portion up. You want to do that because it drives along the paraspinal muscles in an upward direction, which relates to his chi energy. as well as the pathway of the vasculature in his paraspinal muscles. There are 4 layers deep in these paraspinal muscles that we have to go through, from the skull all the way down to the lumbar spine. I'm just going to go slowly over these now. Still applying some really deep, steady pressure as I go through there while he's breathing. And being the patient on this is not as easy as it looks here. Camille's actually holding it pretty good for as deep as I'm going. And then I'm working on these traps up here. Everybody's got these knots in their shoulders. Sometimes they're called trigger points. Sometimes they're really just knots or muscle bundles. And again, I'm just putting a straight, deep, steady pressure on those muscle bundles, and you actually feel them melting under my fingers, like right there, for instance. You feel that one?
Uh-huh.
Now watch what starts happening. You feel that right there? It just melted. Did you feel that?
Yes, I did.
Get on this one. And there it goes. See it melting?
Uh-huh.
Yep. That's a pretty intense feeling, isn't it? Right there. And there it goes, see?
Uh-huh.
Every time. And I'm going to work all the way up into his cervical spine, up to his skull, because he's had some headaches here in the suboccipital region and atlas area up here, so we're going to work on his paraspinal muscles right under the skull. This is suboccipital muscles. Sometimes get trigger points in there, muscle bundles in there, and muscles, of course, move bones. So if you don't get rid of some of these muscle bundles and muscle tightnesses or hypertonicity or spasm in some cases, the muscles will continue to pull the bones out. The bones then pinch on the nerves, and then you've got this vicious spiral of events taking place in the body neurologically. And it is a downward spiral that creates abnormal functions. So right now you can see my thumbs are going right along the base of his skull. I'm sure you feel that too, huh, Camille?
Very deep.
Yes, very deep. And you want to use a cream of some sort on here. I'm using the extra strength blue emu oil that you can get at Walmart's, just because it's also a topical analgesic, so I'm getting kind of a dual effect here for him. But you can use coconut oil, other types of massage oils, essential oils. Sometimes they're fun, smell good, and also have some healing qualities to them. But the best healing quality is the chiropractor's hands on the spine and the body. And thank God I've been given the gift of healing hands, so that's why we see so many people traveling great distances, like Camille has, to come over here from Poland to get treatment for his problem when he hasn't had any success getting treatment there. Alright, so let's go ahead and this also will increase the circulation into these tissues and help them to calm down and heal up quicker. Now see, those aren't as sore as the first swipes, are they? They're still tender, I know, but let's see here. Okay, good. Alright. So now I'm actually going to put another towel on him, and I'm going to use some high frequency vibration with the Rapid Release Technology Pro 2 device. This helps break up fibrotic adhesions and scar tissue, as well as stimulate that somatovisceral reflex. Now you'll feel some really high speed vibration on this one, Camille. Yeah. Now I'm going to kind of hover over some of these trigger point areas that you have. I'm using the flat diffuse head right now. But I will also be using a more focused head here on there as well. Make sure we do it bilaterally, symmetrically. And again, I'm kind of hovering over his thoracolumbar area, which is the area of the nervous system that supplies his diaphragm, his stomach, his small intestines, celiac plexus, basically, that affects all his gastrointestinal function. Okay, now I'm going to switch this over to the more pointed end, and Camille, you'll probably feel a little bit more intense vibration with this, especially right through here. But this again is another one of those things that hurts so good. Even though it's tender, it'll feel better whenever I get done. And I'm not applying any significant downward pressure on this. I'm basically just using the weight of the Rapid Release Pro 2 device itself, but you don't have to push down on it to get the best effect. In fact, you shouldn't push down or put pressure on it to get the best effect, because it's really the waveforms and the high-speed vibration that is what's getting the good effects. I'm doing the base of his skull right now, following that with this tip point. I'm sure you feel that pretty intense as well. And I'm hoping that this helps calm these muscles down and alleviate some of the neurological pressure and the numbness and tingling sensations that he has had, as well as some of the headaches that he's getting that are reoccurring here at the suboccipital region. There's some tender spots in there, huh? Right through here, too. Now, I do not normally take this much time on any individual patient doing this kind of work unless I get paid extra for the amount of time I spend doing this. However, Camille has come here all the way from Poland to receive treatment. This is his last day here, so I wanted to do something special for him and different, that we could see if we could alleviate some of the issues that he's still having, like the headaches and the numbness and tingling in the arms and hands, fingers. His hiatal hernia's been feeling better, so we're just going to improve upon that. But I'd like for when he leaves here today, see if he feels better using this rapid release and doing the deep tissue Nemo work that I did on him today. Again, I'm just following the base of his occiput with this. The paraspinal muscles right at the suboccipital level. And his paraspinal muscles here. All the way down. See, this area here is already calming down. That's even calming down a little bit. Does that feel a little less tense than it did before?
Not much.
Yeah, good. Did much less. It's kind of hard to hear with this on there. Sometimes this vibration is so high speed, it's running over 150 hertz. But sometimes it even messes with the video. So no, you're not on mushrooms. If you're watching this, you get some vibration. It's this high speed rapid release technology creating this waveform. Okay. Whew. It was getting hot on me, so that's time to stop. That's the most I've ever used that on anyone, Camille. Okay, legs are even. Tell me if this hurts at all.
No, nothing.
Excellent. Good. Okay. Get this cleaned off. This won't stain any clothing, by the way, so. Or doesn't smell bad either. Okay, very good. Now you can see how hyperemic or red his skin is where I worked on it here. That shows an influx or increase in the vascularity through here. So you can tell that he's been worked on quite heavily just by the redness on his skin, which is the largest organ in the body. It shows hyperemia or increased vascularity. So let's have you go ahead and turn on your back now. And now I'm going to actually pull his stomach back down through the diaphragm. This will be the first time I actually be doing it on the skin. Take a deep breath in. Let it all the way out. Slip in right under the sternum below the xiphoid process on the left-hand side and grab the stomach deep and pull it straight superior to inferior. Good. Okay. And I'm sure Camille can tell you this is a lot deeper than what it looks on YouTube, right? It is. And one more time. But you've been able to eat more, right? And better, spicier foods since we've been doing this. I always tell people that come in from out of the country or out of the state to come here for hiatal hernia treatment to eat anything and everything they want while they're here. Let's go ahead and slide you all the way down on the table and I'll get your ribs now. A little bit more. There you go. Okay. I'm going to adjust his AC joints. His sternoclavicular joint right here. AC joint, sternoclavicular joint on the left. Now his anterior costosternal joints, which are where the ribs meet the sternum. Then his lower rib cage, and down here you want to be cautious because the ribs on the very bottom part are cartilaginous. They're not bone, they're cartilage on the lower part of the rib cage. But as you can see, we've got his rib cage really even from side to side right now. So he's not lopsided and his ribs aren't sticking up on one side more than the other like a lot of our hiatal hernia patients have done. Very good. Let's set you up face towards Renee now. Good. There we go. So we are still adjusting his shoulders, elbows, and wrists. Just let this go limp. Perfect. Yep. We want to adjust along the pathway of the brachial plexus nerve, C6, C7, C8, to help the numbness and tingling in his arms and forearms and hands and fingers that he's been getting. And hopefully, we'll find out here in a minute from Camille himself how it feels afterwards. Okay, stand up and shake it off a little bit and let me come over here and do the instrument adjustment on you, and then you can tell everybody how this feels compared to the other way. Okie doke. Let's have you flex your head forward and then backwards for me. Excellent range of motion, both in flexion and extension. Now see how you're straight today?
I am.
You are completely straight now. You're level on your pelvis there. Equal distance between your pelvic bones and your hands. Your head's right down the middle. The only thing I'm going to do is accentuate that a bit and then seal it with a X-axis adjustment with this high-speed break my knee in here. Adjusting instrument. This is very specific. There we go. Adjusting the atlas on the X-axis. You can relax now. Okay, let's try that same thing one more time. This should feel even smoother. Yep. Excellent posture. See how his ears are back over his shoulders the way they're supposed to be. Equal distance in his hands, and everything looks great. Camille, would you mind telling everybody how that felt to you versus the other treatment? And do you still have a headache and numbness?
It's getting much better, but the treatment was very tough.
Yes. It's deep.
It's very deep inside all the
It's
muscles.
painful.
It's painful. It's a good pain.
Yeah. It's one of those hurt so good things.
I'm feeling much better, and the whole muscle is going to be like
It'll calm down now.
It'll calming down. So.
And that should help your hiatal hernia and organs too, and the rib cage pain, substernal pain that you've been having.
Yeah.
And I'm hoping also that will help the numbness and tingling that you've been having, as well as your headaches. Do you still have a headache right now?
Almost gone, and this thing's getting better.
Okay, good. All right, well, this is your Houston chiropractor and Camille coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.